Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
So let's talk about adjuvant therapy. Here's a great example of a very positive adjuvant therapy trial. The patients on this trial had stage 3 melanoma, meaning it was in the lymph nodes, and they were randomized to the pembrolizumab treatment for 1 year in blue, anti-PD-1 single agent, or placebo in red. And what did we learn? We learned that the blue group did much better. 63.7% are still alive and disease-free here compared to 44% of the placebo patients. Almost a 50% relative improvement, highly statistically significant. But still, we have to recognize that when we use adjuvant treatment, when we do surgery first and then give this drug for a year, still about a third of the patients recurred despite getting the drug, and about half of the patients got drug who never would have needed it. So only about 20% of the people actually benefited from getting the drug right away after surgery. That's a big deal for that 20%, but it was at a cost. The cost was all 100 people had to get treated for those 20 to benefit. All had to have the risk of side effects of the treatment, even though it was only one drug. Some people had significant toxicity. Everybody had to pay the cost, even if it didn't come out of their pocket. If it came from insurance or Medicare, somebody somewhere had to pay the cost for that treatment. And all those people had to come into the clinic for regular visits and infusions up to a year's worth. And so we know that even though some people benefit when we give treatment after surgery, we don't know who those people are, and we never really know whether we did any good.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.